So I am representing the work package 9 of STOP, which brings together different institutions, particularly WHO, the Imperial College, but also a large group of institutions from public health institutes that are joining the STOP project. And since there was an interesting conversation in the previous session about the inclusion of health, I would like to share with you my thought about the different pathways through which food system influences health. We normally talk mainly about the pathway of unhealthy diets and food insecurity, but we also need to consider that there are other important effects. We have experienced in these 2 years how the exposure most likely to zoonotic pathogens was responsible for major disruptions, and 75% of the infectious diseases have this zoonotic origin. So this has to be related to the way we source and distribute and consume foods. The pathway of unsafe and adulterated foods. I mean, still, we have over 500,000 deaths every year accounted for by foodborne disease. And then the impact that food systems have on environmental contamination and degradation, which eventually affects people's health. And finally, the health of the people who work in the food system, so the occupational hazards. Having this in mind, I think we have all agreed that somehow food system is failing us. It's failing because 3 billion people cannot afford a healthy diet. 820 million people do not have even sufficient energy for their lives. And at the same time, the system does not always ensure a fair price for the producer. And it doesn't reflect the true cost on environment, health, and livelihood. So we all agree that food systems need to be transformed. It's very complex. And this year, the UN Secretary General convened a UN Food System Summit, which was considered a people summit, because there were so many contributions coming from not only the UN organization, the member states, but also a lot of civil society, as well as the private sector. The follow-up of this summit will be important because we are seeing definitely an increased commitment to change the food system. From the WHO point of view, we have identified a series of 6 policy actions to make healthy and safe diets. And first and foremost, the changing of the composition of the products with less salt, less sugars, less unhealthy fats, and more nutritious food in general. So the reformulation agenda. Second, the issue of the pricing of food, where unhealthy options need to be at higher price, whereas the healthy option should be at a lower price. Third, is the offer of food in public institutions. Fourth, is the issue of informing consumers about the processed food and having a clear, understandable nutrition labeling and an interpretive labeling. We're also talking about the importance of bringing back the nutrients eliminated during processing through fortification processes, and then the control of marketing, the pervasive marketing, particularly the digital marketing. So in the context of the STOP project, we analyzed these different elements, and we're very pleased to see that the farm to fork strategy is really comprehensively addressing these issues. And I was really pleased to hear from Stefan that some of these options are also on the table of the European Commission. We've had several conversations with the European Commission. We hope that we could work together on the implementation of these different strategies. So you're now familiar with the stop, structure, and action. So the different work packages have been dealing with these policies, regulation and fiscal policies, consumer behavior, healthy food and food choice environment, physical activity, and healthcare. So the work package 9 responsibility was really to make sure that we had a common way to analyze the science and then to be able to translate this into useful information for policymakers to the policy briefs. So we've developed a set of policy briefs. This is the first list of 6, but we should have a 7th one on physical activity and hopefully even an 8th one on primary healthcare. But what is in the making is nudges for healthy diets, reformulation of food and drink products, nutrition labeling, protecting children from harmful food marketing, public food procurement and services policies for healthy diet, and food taxes and subsidies. So how do we do this policy briefs? We have been looking at the STOP systematic reviews and other relevant studies and evidence. And we've had a series of interactions with the national public health agencies participating in the STOP project. The OECD was convening meetings in 2018, 19, and 20. So each time we've had this conversation. And then we've used the WHO guidelines, guidance and tools, and of course the Codex standard. So we have this drafts. I mean, you see them nicely designed, but actually that's just to present them for you today, but they're still absolutely work in progress. So let me give you as an example the nudges and to see what kind of information is covered in these policy briefs, and then we'll go in the content of a couple of other ones. So first of all, we'll introduce the concepts. What is a rationale for this? And in this case, the nudges will focus particularly on promotion of healthy eating in school. This would influence children's food selection while at school. What is the environment there? That we have food which is offered through different means, through food kiosks, food vendors, vending machines, and of course the tuck shop, the canteens. Of course, the canteens. Water is also an important component of the offer of the food. So the nudges policy brief start with a background and a rationale, and of course an explanation of what nudges mean and what is the theory behind nudges. I mean, as you probably know, the nudges are somehow a way to facilitate and push people to change their behavior. So the policy brief explained why nudging is relevant to healthier food selection in schools, and explained some of the nudge-based intervention and techniques. How can you do that? You can change the physical environment, placement, positioning, presentation, availability. You can change the kind of information you provide, how you call things, and the semiotics is helping us to make the right choice. How certain prompts allow people to make the better choices, but also explains how you have a default, and did you bring that change, and that change in itself is going to be an important element. So, for example, we explain how a change to a physical environment can help making the right choices. I mean, if you have a vending machine where the healthy options are just a tiny component, and maybe not even placed in the right place in the machine, the likelihood that you choose the healthy choice is lower. If you change the amount, the distribution, the presentation, then you will end up with a higher proportion of the healthy choices in people's choices. The same happens with vendor. I mean, if you put the healthy choices in front, the kids will be prompted to consume more. Or other ways to change the physical environment would be to, for example, label a menu with a healthy option, or also to make the presentation easier. So you have not only the piece of fruit, but already the fruit pre-cut, so that children are find it easier to consume. Of course, we need to explain that these actions are producing an impact. So there is evidence of effectiveness. This is where the work that the STOP project did in terms of analyzing the science was very important. When we develop nudges, we need to have a plan to do that. And the policy brief explains the methodology there. There is a cycle there where there is an investigation of the school food environment and the school food options. There is the decision about the target. So what kind of foods and beverages we want to change the consumption of. Then there is a decision about the kind of nudges from really the most appropriate nudges for the environment are going to be included. Then there's an implementation. And then, of course, there's a monitoring phase. In order to do this, there must be a clear engagement with the staff on the ground, food service staff, school staff, food vendors, kiosk holders, and there must be a really good analysis of the environment there. We have a number of country case studies, and this has been based on experience in USA on the presentation of fruit in elementary school, or other plant-based food in secondary schools in the UK. This is, again, work in progress, because not always the kind of evidence we need is there. So there's mixed evidence, there's limited research on long-term effects. I mean, what happens after a few years that we have that nudge in place? Do we need to change that, or simply keeping them would be the good thing to do? We don't have information about low and middle income countries, so it's difficult to generalize. And there is somehow also an ethical dimension to be considered. What are the families thinking, for example? And are there barriers, cost, time, space? So that's the kind of content that the brief has, which is really meant to generate discussion with policymakers in a language that is appropriate to them. I'd like to briefly mention the content of some of the other briefs. One of them is the reformulation policy brief. Now, we heard about clearly the importance of changing the composition of processed food. So we're describing in the policy brief what are the elements of the reformulation. So one of them is the industrial trans fat. Second is the salt and sodium. Third is sugars. Fourth is saturated fat. Fifth is portion size, which is also an element, and energy is connected to that. And then how is this reformulation going to impact food safety? The policy brief describes the tools available. So it describes the kind of guidance and implementation support that could be given to countries who want to embark in that. And here we have remarkable experience in Europe on the reduction of sodium, but also on the reduction of sugar, with a remarkable work that's been done in Finland, the UK, for example, to really understand for each category of food, what is the level of these nutrients that can be achieved without a major impact on consumers' choices. The WHO has been working and bringing together the information from all countries of the world around sodium benchmark, for example. And so we have a tool that allows countries to make their choice and indicate what kind of targets they would like to give to the food industry for sodium reformulation. And it's quite interesting, because you can see that for the same product, certain countries have been able to go much further, and industries followed. So there's not a single standard, and I think there's a lot of flexibility in consumers' habits. Of course, this needs to be done progressively, and the brief explains somehow the method of introducing the reformulation in the countries. It explains also how to engage with the industry in achieving this common view on reformulation. So a lot is about lessons learned. But the lessons learned indicates that political commitment and longer-term visions are key. These are not things that are done overnight. So we have to think of programs that have a life of 5 to 10 years, sometimes longer. The government leadership is critical. Transparent processes, for example, of engagement with industry. Access to data, which are accurate and reliable. For example, the content of the nutrients in food, that's not always clear and not always accessible. And then all the data about consumption to evaluate impact. And then we need a commitment to enforcement, monitoring, and evaluation. So that's somehow the stories of the reformulation. Another important area is marketing, of course. The marketing brief talks about the policy issue and the context and the different situations that need to be considered. So what kind of elements we need to consider when we implement a comprehensive policy to protect children from the harmful impact of food marketing? Which are the food to be restricted? And clearly the nutrient profiling discussion is critical here. Yes, indeed, I think EFSA is tackling that in the context of labeling, but that kind of nutrient profiling scheme will have an impact also on the other policies. In the UK, that was the first step to define really a nutrient profiling system, which would decide what food would be restricted for marketing. The other important element is the marketing types, techniques, and channels to reduce power and exposure. And since the time we started this work, and that led to eventually the WHO recommendation on reducing the impact of food marketing to children, the techniques have evolved very rapidly. And now we're more and more concerned with the issue of digital marketing. So how these different kinds of marketing are having an impact in the different countries. Again, country experiences are quite important. And also here we're trying to understand what kind of arguments we have from the opponents to the establishment of marketing regulation, and what kind of counter arguments we might have. And then finally, call to action. So this was a quick overview of where we are. This work is not finished. We're now going to discuss with the public health agencies whether this concept are what they need, whether they have additional questions to include. We would really like the policy brief to be a useful tool where the information is available, and this can generate discussion and push for the policy process to complete. So I'd like to thank first of all the members of the task force that are producing the brief, and then all of you for your attention. Thank you very much.
Thank you, Francesco, for this very nice presentation of the work of WHO in Geneva. And it's just good to see that it's not EU, but global-wide approach, which we can all benefit from. I'm just wondering if something is still in the chat. Otherwise, I'm really encouraging you. Your feedback in the chat is really valuable. Thank you for this highly informative presentation. As it is argued that we cannot see human health and environment issues as single problems, I was wondering if there is also attention to environmental sustainability in the policy briefs. Francesco, very short answer for this one question.
Not directly. I think we need to look into that and maybe have a separate conversation about that. But sustainability is more about what kind of action we need to take. then the way we shift the diets also to consume sustainable diet is using somehow the same tools. So although it doesn't explicitly talk about sustainability, then I think the impact of the work and the implementation of these policies will be on sustainability.
Thank you so much, Francesco. Here is another question in the chat. If you can answer in the chat shortly, or if you look at it, very short answer.
Yeah, very short answer. We need to have a dialogue with the food industry. We need to have an engagement because particularly for the reformulation, they will have to take the measures. But there must be a public head leadership and a clear process for engagement that avoids that we have conflict of interest, something which is regulated, something which is transparent, and something which is evaluated to see if these engagements are appropriate.
Thank you so much for that very clear position, and I think that was something for what also the member states were calling yesterday, or the participants. Thank you, Francesco, for that. Back to Franco.